Welcome, everyone. It's so great to have you join us today with this webinar on navigating the ins and outs of hiring in this ever-changing dental industry. Here at HR for Health, we're constantly getting questions about hiring, whether it's advice on where to find employees, how to develop job descriptions, or the secrets to longevity. Our members are always having trouble amidst the staffing shortage. So we decided to team up with our partner, Kwikly, an on-demand staffing agency for dentists. They take care of vetting hires for full-time, part-time, and even flex positions, enabling dental offices to provide consistent care, reduce the stress of scheduling staff, and get more value from temporary staffing. And if you're new to HR for Health, we're an all-in-one HR software solution dedicated to helping dental practices automate their day-to-day activities. From onboarding your new hire in seconds, tracking timekeeping and overtime down to the second, to performance management and payroll, we have everything you need to be more efficient in your practice. So our experts today, we have Jill Hasselman, SVP of Strategic Partnerships at HR for Health, and Amanda Sputzoser, Director of Operations at Kwikly. They are here to show you the useful tips and tricks to building a strong and successful team in your dental practice. They'll talk about essential skills, tools, and techniques needed to attract top talent for your dental practice and keep them happy while they're working there. So before I turn it over to Amanda, I wanted to remind you to send any questions you have into our chat box. We'll be sure to answer those in the Q&A session at the end of this webinar. And then additionally, we have a hot off the press resource for you all. It is the ultimate hiring playbook for dental practices put together by ourselves here at HR for Health and our team at Kwikly. So stick around to download that at the end. And if you can't make it through the whole presentation, we will send out the recording, the slides, and the resource after the webinar airs. So I will turn it over to Amanda to go ahead and take it away.
Thank you so much, Taylor. So first I want to talk a little bit about today's market. It really shouldn't be news to anyone who is in dentistry that hiring really remains a top priority for many offices, really since 2020 when everything shifted with COVID. Quickly, we do an annual survey of our offices and our professionals. And amongst our offices, we found that nearly half of them plan to hire in 2024, which is pretty in line with the ADA's survey as well. Of those looking to hire, nearly half of them are looking to hire hygienists. So hiring is on the forefront of a lot of these offices. And even more impactful from that, 1 in 4 dental practices, they're pointing to staffing gaps as the main reason that their schedules are not full. When offices can't serve their patients, there aren't hygienists to see them, and there aren't assistants to help the dentist. And so really, in the bottom line, patients aren't being seen and offices' bottom line is suffering. A lot of practices are starting to use a variety of options to find candidates. We're going to get more into this later, but you can see here a lot of them are using things like Indeed for their online recruiting. Word of mouth is pretty common, dental job boards, and staffing agencies and recruiters like Quickly, which again, we'll dig into this more later, the benefits and some of the drawbacks of a lot of these options. Dental professionals also are looking for options. The current market means that they get to be choosy, which means that you, as an office doing hiring, you need to be intelligent and deliberate with your hiring process. You can see here that from our survey, nearly a third of dental professionals want to add more temping into their schedule. This is in part because they want to dabble and find a new home office that better fits them, and also in part because they really just want to take control of their schedules, get more work-life balance, and have more flexibility. Both of these are things that you can actually keep in mind as the hiring office when you're looking for candidates, and you can frankly use them to your advantage when you're setting the hours and the schedule for your new candidates. Some professionals are also interested in changing roles within a dental office, as you see here. Ways you can harness this when you're hiring is hiring professionals into cross-trained roles. For example, you could post for a dental assistant who might be cross-trained as an insurance coordinator. Keep some of these stats in mind as Jill and I start to dig a little deeper into the hiring process because you really can harness these. These numbers don't necessarily mean a negative for your hiring process. There are obviously some challenges too in the dental industry. One of them, a big one, is the competition for talent. Currently, there is significant competition out there for the talent that we're looking for dental professionals. One of the biggest, most obvious is competition with some of these larger practices, the DSOs, the healthcare systems, that they have dedicated departments and people whose sole job is to do the recruiting for these dental professionals that you are also competing for. They have, built-in automatic text messages and emails and mailers going out to these professionals, and so you need to find ways to stay ahead, and we'll give you some of those tools a little bit later on as to how you can directly connect with some of these professionals that you are also trying to target. Something else that is important to keep in mind for competition is the staying competitive with pay and benefits. For the pay to stay competitive, first you really need to do your research to make sure that your hourly pay is in line with the market. The way to do this, I mean, there are many ways, but first you need to get on job boards and just see what other positions are posting for. You should ask around to other practices to see what they are also hiring at. And really, one of the key things is to not make assumptions that you know what the going market rate is. I cannot tell you how many times we've seen offices come to us and say, I'm looking to hire at $40 an hour. And, you kind of fight the urge to shake them a little bit and say, the going market rate right now is $10 more than what you're looking for. And they're not trying to be cheap, they're just out of touch with the market. And so really making sure you know where that line is crucial. But on the same line, if you are priced out of that hourly, that's fine. You just need to get creative with the benefits. Beyond the basics with the benefits, there's the health insurance and the PTO retirement accounts. We see offices offering things like in-house dental, scrub allowance, tuition reimbursement if you're trying to attract new grads, which is always a good option. Offices are getting creative with things like gym memberships or massage reimbursements. Some offices are also using sign-on bonuses to attract, new hires. And sign-on bonuses are great because you can use them for retention as well, which we'll get to in a second. If you're, structuring those appropriately, you have a 6 month and then a 12-month payout. Make sure you're documenting the terms of that, but they can be a useful way to get people in and keep them in a little bit longer. And then lastly, career development, that's huge too. And it's a source of competition for you because a lot of professionals, they want to feel like they can evolve in their position, whether that is within an office or outside of one. And so really you're competing against other clinical roles at other offices, but also non-dental roles as well, whether that's, a sales role, a teacher role, or even something entirely outside of dentistry.
Yeah, so let's dig into the retention side a little bit because hiring and training new employees can result in some pretty big costs. And that's not just because of the expense it takes to find new people and then onboard them, but also because of the lost productivity that occurs when you have those gaps in your schedule. And then, of course, the learning curve of getting a new employee up to speed. And so while the cost on this can vary, replacing an employee typically costs 2 to 3 times their salary. And so if you're focusing on retaining your existing team members and really putting effort in building a plan on how to do that, this can help to grow the practice. And in an ideal world, this results in you needing to hire more team members to help support that growth instead of replacing that person. And Quickly has, a great tip here. Just even bringing in maybe some temps to help to ease the burden at different times of the year. Maybe you're a pediatric dentist and summertime is really, really crazy. The team's getting burnt out. There's ways to bring in some of those team members to help when your more permanent, full-time, long-term employees need to take time off. So it's definitely a good strategy to look at. But again, ideally, you're not having to bring in people because you have lost, 2, 3, 4 team members. It's really being able to position yourself of focusing on keeping the people that are in the right seats, that are really good employees for you. And then you're building on top of that as opposed to replacing. So how do we do this? A lot of different ways. I think
First and foremost, a positive work environment definitely plays a really crucial role in employee satisfaction and retention. So, we work with thousands of clients across the country, and we understand that a lot of the times the doctors, the owners, like you guys are clinical dentists, you want to just focus on the clinical side. And so sometimes the environment in the office is just kind of run by the employees, and we don't really want to pay attention to it. But what that can do is create situations that, aren't really great, that people don't always want to come into work every single day. And so you can start by implementing seemingly small things that might have a bigger impact on the practice as a whole. So things like team lunches once a month or some sort of bonding activity that's outside of the office, giving your team the space to collaborate with one another outside of their normal work environment can really help to build those relationships among each other without really having to break the bank too much. Another idea is, you might designate a few minutes in every Friday morning huddle for the team to share something good that they witnessed that week. It doesn't necessarily have to be something that happened in the office. It could, but just kind of this concept of like, tell me something good, and bringing in, that positive aspect of something they were a part of or something that they learned to bring, to uplift the environment a little bit each week. So little things like that can really help to make an impact to create a place that is a little bit more positive for them to come into work every day and feel like they can trust and they know their team members. The other thing is creating an environment of transparency and open communication. So this means expectations of office protocols and policies are in writing, they're distributed to every team member, and then probably most importantly, they're actually followed. So when I say actually followed, I mean if your employee handbook says cell phones are not allowed during working hours, you're not allowing your favorite or most productive team member to use their cell phone because they're your favorite and they still get stuff done. You're keeping it consistent, you're following what you have in writing, and making sure the team sees that example that you're setting. And other examples, if you have an employee who is constantly late or violating your attendance policy, but once again, you let it slide for them because they're really productive, it's great for the practice. The thing is, the team sees this, the rest of the team takes notice. And this creates an environment where, one, they don't take your policies as seriously for themselves. So it makes it more difficult to hold everyone accountable, but it can also create this sense of perceived favoritism. And that's not really helping the team to work better with one another. So, using those tools that you probably already have or hopefully already have, like your employee handbook, and looking at it as, no, I'm actually going to follow these policies. It's not, it's not subjective, it's just objective of these are my expectations. And if everybody isn't following those, that you're addressing that and making sure you have that consistency. Another thing is employees are more likely to stay with a practice that invests in their growth and development. So Amanda kind of touched on this. I would really recommend asking your team what skills they want to sharpen and offer opportunities, whether those are CEs or something else, for them to be able to advance themselves. So a lot of our clients do opt to offer a continuing education benefit where employees get a certain dollar amount per year, or whatever that structure looks like. It might vary per practice, but that it's allocated for them to be able to use for CEs and keep that consistency of being able to better themselves in their positions, and definitely helping, like Amanda said, if they're looking to go into a different position in the office, that's a great way to say, hey, I'll give you $200 a year after you've been with me for 1 year, something like that. The policy can differ. Just make sure if you do decide to do this, it's in writing and everybody knows it's fair for all the team members. Again, it doesn't have to be day one, they all get this benefit. It might be they have to put some sweat equity into the practice for a little bit, but it is really nice for them to look at, oh, I can work towards that. The longer I stay, the better it is because I'll get those rewards. Also, implementing recognition and reward systems. So this doesn't necessarily have to be a straight bonus incentive, although some employees really do like that motivation. But it could be something like earning an extra vacation day as a reward. as Amanda mentioned, work-life balance is a really big motivator for employees staying with a practice that's becoming more common for them to talk about, think about, want out of their work environment. And giving them these extra days doesn't necessarily mean they can take off whenever they want. Your employee handbook policies should clearly state how long in advance they must plan for a day off, when they need to notify you. But it's a seemingly small way, but can make a really big impact that shows that you care about them. And it also could be something as seemingly simple as public recognition. That recognition can really go a long way. And this varies per practice. Like, I would really recommend asking your employees for feedback of what motivates them. How do you like to be recognized? And so that aligns with what you're actually offering. Because, we even experienced this at HR for Health. We were giving monetary benefits in an area where our employees just were like, yeah, that's great, but I don't really care that much. And so we were able to realign that and put some things in place based on what our current team was really looking for. So being able to foster this positive work environment and really focusing on, okay, does it feel heavy to come into my office each day? It might mean that there are some opportunities to implement maybe all of these tips or a few of them to start to roll it out so that employees really see you're listening to them, you hear them, it's a place they want to go. And again, as I mentioned earlier, Kwikly can come in and say, sometimes it's just the workload, the environment's great, but it's just really stressful. The workload's crazy. And you can bring in some temporary employees to help fill in when there are those really, really high influx of patients so that they can have some time off, but also you don't have to go without seeing patients. So we can't talk about bringing new people on, especially with temps, without talking about worker classification. So worker classification, for those of you that aren't as familiar, is really when we're looking at employee versus independent contractor. I have to preface this by saying this does vary per state. There are some states where absolutely it never, ever, ever makes sense or is allowed for somebody to be an independent contractor, regardless of the position. You have some states that are a little bit more flexible. So please reach out to us if you have questions. I'm kind of talking general rule of thumb with this, but some practices use temps to use that as a way to address the staffing gaps, but then they bring on temps as independent contractors. The thought process is, well, this person isn't always going to be in my office, so it makes sense that they would be an independent contractor. The issue with this is that while it makes it a little bit easier, maybe upfront to onboard them, there are pretty complex regulations around hiring and paying an independent contractor correctly. So it's really important that you know how to do this right, that you're classifying them right, because these seemingly small things can be really expensive. And I'll talk about that in a second. So the general rule of thumb is that an independent contractor is if the payer has the right to control or direct only the result of the work and not what will be done or how it will be done, meaning the practice, you're the payer in that, you are not directly controlling how the work will be done or when it or what will be done. So thinking, independent contractor, they're basically should be able to work independently. So that doesn't necessarily mean that they're autonomous in their role. It means that they're able to make their own rules. So they decide whether they're going to work, when they're going to work, how they're going to work. And that can be a hard standard to meet if we're talking about a hygienist, for example, because they need to abide by the rules of your practice. You're looking at associates. If you bring in somebody and classify an associate as an independent contractor, which is really, really common, the regulations are going to look at whether and how you control their work. So are they able to make independent decisions, and how are they working on patients? Are they able to set their own schedule? If they are truly, again, independent, a great example that's a pretty clean one is if you are a GP office and you're bringing in a specialty associate, that is bringing their own materials, is bringing, their own patients even, is really makes their own schedule, that's usually okay for them to be an independent contractor. If it's somebody that is under your control, if you're making their schedule, you're telling them when to come in, they're using your materials, they're working on your patients, it's pretty unlikely that that team member would be classified as an independent contractor. So think through that when you're looking at your teams, because what we found in the state of HR survey that we did last year, very, very high response rate that associate doctors are classified as independent contractors. And again, I know that this is really common. It's not like it's never okay, but you definitely want to assess for your individual practice, how much control do you have over that associate or a hygienist or a dental assistant? Like, just keeping in mind, just because they're a temp or they're an associate does not necessarily mean that they default to being an independent contractor. And the good thing is that we can help to ensure your employees are classified correctly. So again, if you have questions, there's like checklists that you can go through. There's a whole criteria that makes somebody be allowed to be an independent contractor. So we can walk you through that. We make sure that they're classified correctly, because there are a lot of issues that can arise. And why? Well, the consequences can kind of have a ripple effect. So when somebody is classified as an independent contractor, they do not receive the same rights as an employee. Makes sense. But on the other hand, if somebody should be classified as an employee, but they're classified as an independent contractor, that person is missing out on the rights that they have to certain offerings. So things like minimum wage or overtime pay, that independent contractors, that just doesn't exist for them. They don't have overtime pay. They're making their own hours. They are paying themselves. With an employee, they do have requirements for minimum wage and overtime pay. Also, things like benefits. So insurance, this is paying into their insurance versus them having to have their own insurance. Paid time off, if you're in a state that requires you to offer sick leave to your employees, for example, but you're classifying them as independent contractors, then they're not getting sick leave. And that's a benefit that they should be getting because they should be an employee. So it's important to remember the reason why this is such a big issue is because there's two government agencies that care about properly classifying employees. There's the IRS, and then there's the Department of Labor. So the IRS cares because they want to make sure taxes are being paid correctly. And if you're improperly classifying somebody as an independent contractor, then both the practice, the team member aren't reporting those payroll taxes in the same way that you would if they're an employee. So you could potentially be underpaying, and the IRS doesn't like that. The Department of Labor cares because their job is to make sure workers' rights are being upheld. And so it might seem like it's not a big deal. The people coming in are like, yeah, classify me as a 1099, pay me as a 1099, because that might be the norm in some of the other offices that they're working in, but that doesn't necessarily mean that's right for your office. And I'll give you an example of like, what's the worst that can happen? We get asked that a lot. And if you think back to COVID, most offices had to either lay off or furlough their team. And what happened is that for those people that were improperly classified as independent contractors, a lot of hygienists it was common with, they weren't paying into any unemployment funds because they were an independent contractor. And so while it was recommended, it's okay, furlough them for a little while, they can collect unemployment, that doesn't apply to somebody if they're an independent contractor. And so it created a really stressful environment for somebody. Not only are they, not being able to go to work every day, but because of the way they were classified, they couldn't file for unemployment. The good thing is that eventually the government did put out some benefits for independent contractors, and they were able to get funds. And I'm not necessarily saying that drastic of a situation would happen again nationwide, but it's really important to review what you're doing right now and realizing this really does have an implication if something happens to that employee and they need to go on a leave of absence, or they need to use some of these state benefits that are there for them. They can't always do that if they're an independent contractor. And so it's really important to make sure that you're looking at, okay, who am I currently classifying as independent contractors? And who in the future for these roles would I maybe classify as independent contractors, and work with somebody like HR for Health, our team. Make sure you're doing your research so that we can help you to make sure they're classified correctly. Again, this does vary by state. If you're in California, it's almost always a no-go. If you're in other areas of the country, it might be okay. So just reach out to us if you have questions about this so that you don't fall into any of these traps of, again, the IRS and the Department of Labor looking into what you're doing.
To echo like the tax implications, it's so important. It's just the accurate classification means those obligations are met. Another example, like what's the worst that could happen? We were working with an office that they got audited and they had to pay back payroll taxes. And like there's a big impact to the bottom line from the office side too. So it's not always just the professional that's impacted when the misclassification happens. The office oftentimes is too. So that accurate classification is important on both sides. But one of the other things to consider is that transparency and the stability to the dental staff, it comes into play with the benefits too. So it's, when the office is paying them as a W-2 employee, they're eligible for the things, like mentioned with that overtime, but also the internal benefits to that office. So it adds a sense of community to that professional where they're a little bit more invested in that office too. They feel like they're a part of that office or a part of whatever agency, if they're a staffing agency that they're working with, that's kind of just supporting them there. So really, it's just important to consider on both sides. So I definitely want to echo that importance with the tax implications.
And
And
it's
then to talk,
ironic because so many offices do the 1099 method because they think it's saving money. And then these audits happen. It's like, nope, it did not save any money. It was actually way more money in the long run.
it's good until it's not. It's
Yep.
really the gist of it. But so we like to the kind of the staffing side of it. That's why when you're using a temporary resource to kind of help you, whether it's for a day here or there when there's a vacation, or if you're using a temporary resource, a staffing partner to help you while you're hiring, it's useful to work with a staffing partner that assigns and classifies their temps properly as a W-2 status because it gives you that assurance that you are protected. If you are working with a staffing partner that classifies them as a 1099, it's kind of like they're washing their hands of it, honestly, and they're coming into your practice and you are responsible for collecting that W-9 information from them, for getting them the 1099 at the end of the year, and for making sure that everything is done properly with the liability insurance and all of that. And even for paying them directly in a lot of situations. And so when you're working with an agency that's really kind of upholding the best practices, it's reducing your administrative burden. You're covered, with the legal, the regulatory standards, and it just protects you. And I always say, let the companies like HR for Health and Kwikly Dental Staffing, we're the experts in this sort of thing. Let us worry about it. Whether it's with your permanent employees, with your temporary employees, you should just worry about the things that you're good at, the dentistry. That's what matters. And it frankly, from the staffing partner side, it is for the agencies that operate as 1099s. In a lot of ways, it's more simple to be that type of staffing agency, but it is the best practice for us to treat our professionals as W-2 because we are protecting them if there is another COVID situation, if there is we always use the example of a needle stick or something. Our professionals are protected, and you should want to work with a staffing agency that cares enough about their professionals to protect them as well. So, things to consider with the classification. It kind of hits on a lot of different levels: tax, labor law, the types of professionals you're working with. So, a lot of levels to consider with the classification.
Mm-hmm. Yep.
All right, now the most important part, the hiring process. So we talked about the market, we talked about the classification. Now, kind of the key thing, I guess there's a few steps to the hiring process. I guess, Jill, you'd probably agree. I mean, it's between the both of us, we have sort of like a few steps here, and it's really tempting to just go to the posting and the hiring and like get them working in your office. But I would say you have to really kind of lay it out so that you don't have a problem in the end by bringing in the wrong person. So we have like this chain of events. We want to assess our needs, create that job description, bring the right people in screen them, and then ultimately onboard them in a way that's going to lead to that retention that Jill talked about and keeping the best people with you, long term. Awesome. So let's talk first about kind of that assessing of your needs. It's important to understand the actual scope of the needs of your practice so that really you get the most value for the position that you're hiring for. And I would say a common mistake is management is just jumping to post a position without really understanding the contribution that the specific role is making to the long-term growth of the practice. And it leads to either wasted effort in hiring the wrong type of person, or unhappy employees in the long term. And so, a few key ways to do this: analyzing the workflows in your practice and kind of the patient loads. So, what that means is you should analyze your practice. Like, where are you busiest? Peak operational times. Where are the bottlenecks or places where your team is stretched thin? Where is your optimal patient care reduced or compromised? And then you can identify where extra hands are needed. I find that it's really useful to talk to your current team and ask them, where do you need help? And they usually are able to point out things to the managing team that they're kind of blind to. And this goes back to what Joe was talking about earlier with kind of fostering this positive environment. And it just helps them feel heard and supported when they're able to vocalize, this is what we need, kind of just as a unit within the office. Next, what you should think about is the growth trajectory of your practice. If you're planning to add new services or new technologies or locations or increase patient capacity, you should be planning ahead for that now with your hire. If you are hiring multifaceted staff or hiring in departments that will need future growth and getting that in place now, it's going to be easier to support that growth in the future. Like, for a specific example, if you think you're going to be adding a milling machine to your office, look for a dental assistant who has that experience now. So when you get that machine in, it's less of a steep learning curve for your team, or if you're a hygiene department, if you plan to add, a bunch of new patients, you build up that hygiene team now so you're not scrambling down the road. Other things to consider: what skills or specialization exist in your team now, or where are you lacking? So do you need someone who is more well-versed in closing on big cases? Or, kind of with that milling example, think about those things where you need to just kind of add in skill sets or strengthen things you have within your office. Another thing to consider, of course, is the budget. Adding a team member, of course, it has cost, and you need to honestly be realistic that if you're adding someone in, do cuts need to be made somewhere else? And if so, where, and what will be the impact to the rest of the team with those cuts? Or are you adding a position like a hygienist that is a revenue producing position? And will that revenue be enough to cover the additional overhead of that person? And lastly, after you kind of run this assessment, it's important to document your findings kind of in a comprehensive document that you'll use in the future as a foundation for sort of the roadmap of where your practice will go when you're kind of mapping out the growth. And it'll help you to create a hiring process and a future for the goals of your short-term hiring as well as the long-term vision for your practice. All right, next is your job description. Undoubtedly, you've seen a lot of job descriptions. You've probably made your fair share of job descriptions, but really a good job description, it goes a long way in attracting the right candidates for your job so that you, A, don't get a bunch of mismatched candidates, and B, you actually attract the right candidates. HR for Health, we have great resource attached to the end of this here that has some really good examples of some great job descriptions that you can use. But just to kind of give you a high level of some things that I would definitely focus on, job descriptions need to be more than just a list of adjectives. It really needs to paint a picture of the role and what it means specifically to your office. You should be describing the culture of your team and the vision for your practice as a whole. An important thing is to avoid the urge to use cliche language. The thing that I always say personally, the word rock star. If I never see the word rock star in another job posting, like, just nix that from your postings. Like, Jill, do you agree?
It's just completely. Yeah, it's a buzzword.
It's just the worst word. Never use that. So rock. take it out. But the other things in your job postings, I would say one of the most important things, you're obviously outlining key responsibilities and duties, but a lot of practices have other expected duties. Like for a dental assistant, for example, you might have the DAs in your office doing things like ordering supplies, or I don't know, maybe they're in charge of OSHA compliance or something. Include those in your job description too. Just anything unique or unexpected beyond normal role. You don't want to surprise them, for one, once the job starts, but also you'd be surprised how often those unique things draw in people who want those specifically. And it really ties into what Jill and I mentioned earlier about kind of that career growth and development. They want those things to expand beyond their role.
Mhm.
Um, Other things, you know, when specifying skills and qualifications, you're including the degrees and certifications, of course, but also there's specific traits and soft skills. When you're listing those, think about the ones that are specific to your practice and aren't those buzzwords. It might be challenging here, but try to avoid the cliche language and really be clear about the traits you're looking for. Like rather than like good communicator, I would be like, you know, maybe if it's like your practice deals with a lot of like families, young families, like someone who's well versed in dealing with children, like, you know, get very specific to your needs so that they know exactly what type of good communicator you need. And then if it's appropriate for the role, again, emphasize those growth opportunities. You know, whether that's continuing education, like we talked about earlier, or the cross training, potential to move into a clinical role. It's candidates are just drawn to positions where they can see themselves evolving. People don't want to be stagnant. So it's good to paint that picture. But on the flip side, if there is not that avenue for growth, it's really important not to include that. So be really honest with yourself, because you don't want to make some promises that you can't deliver on. And then the other key thing, super important to include the wages, benefits, and perks. I've seen postings where they're kind of cagey about that, and those things end up being a deal breaker down the road. So you might as well just include it up front, to avoid wasting everyone's time. And then lastly, one of the like big things is you need to paint this picture of your practice culture in your job posting. And it's the reason is you need to have the candidates be able to see themselves in your practice. And so the way to do that is just focus on what makes your office unique and avoid using the buzzwords and like we're a great team, we love each other. It's think about things like are you passionate about adopting new technology or like airways, or is it like your office always takes an annual trip to the doctor's cabin? Just anything is fair game to describe what the culture or the vibe of the office is. But the goal with doing that is just to describe the office and inspire them to take action to put themselves into that space. That's what really gets them to apply ultimately.
Yeah, and one thing to add too, and that a lot of people forget sometimes with job descriptions is you definitely want to have a section in there that outlines what the essential functions are of this role. And what the essential functions are is pretty much what it sounds like of the things that they absolutely need to be able to do to have this role. So the reason why you want to do that is because first of all, from the hiring perspective, you want to make it really clear of these are must-haves that you need to be able to perform. But also, you know, we'll get to the onboarding part, but let's say you decide to hire them, that job description with the essential function, if that employee ever has to go out on leave or something changes or they try to modify their position for whatever reason, that essential function section is really what you're going to rely on to make those decisions of can I actually accommodate that? That comes up very frequently with disability leaves, you know, pregnancy, those sort of things. And this does not mean that you put everything under the sun in the essential, you know, in the essential qualifications section. That's not fair. It's things that are truly essential to that role. So if it's a dental assistant and they need to be able to handle certain tools, they need to be able to sit for a certain amount of time, whatever it might be that is absolutely essential for them to be able to complete their job for you. Just keep your eye on that. Make sure you have it. As Amanda mentioned, we have some examples in our resources, but that can be, you know, it's not a big section. Again, it shouldn't be a list of everything under the sun, but it is really, really important for you to have that. So you're setting yourself up to not be in a situation, whether it's somebody you're looking to hire or somebody you already have, that you're in a place where you didn't put that expectation out there and then you're kind of stuck.
Attracting talent is, I think, where a lot of people get stuck. The creating the job description, a lot of, what we just covered, I think that people can kind of get there, at least, 80%. And there's a lot of good tips that we just went over to take it to the next level. But the tracking is where people really kind of hit their head against the wall. And so kind of the first thing to consider is you need to use various channels. However, you need to keep in mind you're looking for quality over quantity. And so be choosy over what you're doing. But let's just go through kind of what we have here for the list. Job boards, obviously a really good place to start. They're very common. I would say the most common job board currently, Indeed, casts a really broad net. There are dental specific job boards as well. They're not as universally used, but they are a pretty good option. So depending on which part of the country you're in, you kind of can just look and see which one's the most appropriate for your area. Word of mouth is a good avenue, especially if your practice is well respected in the community, or if you have a big network of like happy employees, happy former employees. The best way to lean into the word of mouth channel is just offer like a hiring bonus for, if you find us, our next hygienist will give you $500 or something. That really motivates people to have their friends come and work with you. And frankly, they're not going to bring someone that they think is someone terrible that they want to work side by side with. So it's really a good way to get quality people if you already value your employees. Staffing agencies and recruiters are becoming much more heavily utilized. Um, Oftentimes they have a higher cost, but they can provide additional resources and higher quality candidates because they have established networks. So, staffing agencies like Kwikly Dental Staffing, we specialize in finding vetted candidates that meet your specific criteria. So it takes a lot of the legwork out of it ahead of time and kind of just puts you a step ahead in that process of like finding people. So we arrange the pre-screenings, we do the working interviews, we're, taking all those first screening steps out of it for you. But one of the biggest benefits of using staffing agencies or recruiters is that we're able to target and spark interest amongst potential candidates who aren't even actively searching for positions because we have this network established already. So there might be, Samantha down the road who's super happy with her dental office, but we connect with her, we tell her about this great opportunity about, we paint the picture of your office, and all of a sudden, there's this idea in the back of her mind, like, actually, maybe I am interested. And so that's where staffing agencies have a lot of success. And the other side of staffing agencies is that a lot of them, like Kwikly, we provide those temporary staff for the practices while you're in that hiring process. So it allows you to take the time to find the right candidate rather than rushing into a hire that's not correct for your office. In social media, this is an avenue that it's kind of hit or miss depending on what your social media presence is like. If you have a lot of followers, it can be a good option because you have a big reach. However, if you don't have a big presence, it's not going to do much for you. But Facebook, Instagram, even LinkedIn can be a good option. I would say the dental community is growing on LinkedIn amongst professionals, so that often is a good place to kind of get your network out there. But social media, I would say when we're talking quality over quantity, sometimes you get a little bit more into that quantity, less of the quality component of things. All right, screening. This is my favorite part, like the interviewing. This is where you really get to the meat of who a good candidate is and like, deciding if they're going to be the right fit for your office. So in this evaluation, there's really three goals, and I think it's important to consider all of them. So we want to, the obvious one, learn about the professional, right? But the other two goals, we need to paint a picture of our practice and give them the image of what it'll be like working with us. But then the last one is we really want to establish a positive view of our practice, whether or not they're working with us. We want them to leave thinking something positive about us because we might cross paths with them in the future. And they're going to be part of that word of mouth in the community. And so we want them to have a good, view of us. So going into this interview environment, step one, obviously we need to build some rapport. And I think, frankly, some people are better at this than others. And so it's good to actually take a moment to think about it. How do you build rapport? I mean, you small talk, right? And no offense, dentists who are out there, not always the best at this, but ask them about themselves, their day, their background, how they got into dentistry. throw them softball questions at the beginning so they can relax a little bit. I would encourage sometimes when you're doing an interview, bring in another person. So there are two people doing this interview. Bring in like your nice, friendly faced front desk person who can make them feel a little bit more relaxed. That's honestly one of the best tools I'd suggest to help that person feel more comfortable in that interview. Um, but then after you're kind of getting into that interview, the thing you need to focus on next is asking the right questions. And the key here is you need to figure out if they know how to do dentistry the way your practice prefers to operate, but also if they think about dentistry the way that your practice does. And so the goal is to ask open-ended questions to learn about their experience, their perspectives, and like their dental philosophy. And so you don't want to have a checklist of have you done scaling root planing? Do you do local anesthetic? You want to try, maybe situational approaches. And so if you're interviewing a hygienist, for example, my favorite question for a hygienist is pretend I'm a patient, I'm in your chair, and you just did my perioprobians. I need scaling root planing. What do you tell me about periodontal disease? And how do you describe the scaling root planing procedure? And the goal in that is it lets me learn about their clinical understanding of perio. It lets me get a sense of their communication style and their overall approach to patient education. So it really hits on a lot of things, and I learn about them, a lot about them with that question. We have resources at the end that kind of hit on some other great interview questions, but you should use things like that to just get a really holistic sense of what their approach to dentistry is, because that is really what boils down to if they're a good fit for your practice, kind of their approach, right? Um, and always ask follow-up questions. Don't spend your time in the interview mentally preparing for what your next question is. You need to actively be listening. After the interview, assuming it goes well, you're going to want to gather some references from them, usually, 2 to 3 supervisors, former supervisors. With those references, ask open-ended questions. A lot of references won't give you much information depending on, their own philosophy or, legality, depending on the state that you're in. They might just do yes or no's. But if they are willing to give you info, that's always great. Background checks, I always recommend them. Jill, I don't know what your stance is on them, but reputable third party to give you that complete
Yes.
criminal background. Yep.
Yes. Just use somebody that is credible that is not going to give you information that you're not allowed to know.
It's like you gotta be really careful legally with those.
Yeah. Yeah, and they're actually, I mean, again, this varies per state. There are states that have passed laws recently that you are not allowed to do a background check until you actually have an offer out to that person. And then if you get any information back in that background check that makes you not want to hire that person, you have to be able to prove why that information from the background check is a negative impact on that job description that you've written that they have to be able to do. So there are definitely, it really varies per state. Biggest thing I think with references and background checks, make sure you're just getting authorization and that you know when the correct time in the hiring process is to do them.
Yes, that's good. Refer to HR for Health for all. Give that. And then, I mean, lastly, assuming, we've gone through a hiring process, everything's checking out, making the offer. Honestly, I could probably talk for an hour about making an offer and some of the back and forth there. So not to get too deep into it, but when you're making your offer, make sure you're spelling it out really, formally in this offer letter in terms of the benefits, the expectations. I'm sure HR for Health has a lot of resources there as to what that looks like and how to do that. So I don't know, Jill, if you have anything you want to say there about the former offer.
Yeah, again, in writing, make sure really everything that Amanda has hit on, you want to make sure is consistent for everyone that you're interviewing and potentially looking to hire, asking the same questions to everybody, writing down the answers, that in keeping that documentation, keeping their resumes, getting authorization for the reference checks. And then the offer should be really clear in terms of the days that you're expecting them to work, the hours that they're going to be working, any of the perks, benefits, all those things we've been talking about. All of that stuff should be in writing. You want an at-will statement on there to make sure it's not implied as, an employment contract. So as Amanda mentioned, like we have templates that we can provide to help with this. But the biggest thing is just making sure it's really objective, consistent for everybody. You have what you're offering in writing, so there's no question, and also just so it doesn't, get them off on a weird foot where they don't know what's expected of them.
Right.
One other thing I want to mention too, in terms of through the screening process, as you're creating the job description, we get asked a lot what is appropriate to uncover from the applicant regarding salary expectations. And again, this varies per state. I'm sorry, I'm a broken record. It's not my fault. The states have all different laws, but general rule of thumb, about half the states right now do have salary inquiry like regulations, meaning you are not allowed to ask the employee what they are making at their current office. That is a misstep that some practices can make. And I understand why you want to ask that, but instead you want to ask them what they're expecting to make. The goal of those laws is to try to eliminate or shorten the wage gaps. And if you're asking them what they're making before and then you just give them that, it's not really helping to, improve the overall wage gaps that we see in the country. So just keep that in mind. Again, making sure that you are on top of, use HR for Health if you have questions on this of what you need to be doing in your state, but just don't fall into that trap of asking them what they are making. Ask them what they expect to make, and you can still get some insight there. Okay, so once you find this great person, which is so exciting, we don't want to fall into the trap of, oh my gosh, we have so much to do. We're just going to throw them into that on day one. They're going to figure it out. It's really important to set the tone for your practice right from the jump. You only get one chance to make a first impression. So make sure that you communicate with the new team member what they should expect when they arrive on their first day. So for example, if they need to park in a certain place in the parking lot, or if there is a certain team member that will be greeting them on the first day, if they have a set kind of plan for those first few days, you can share that with them. All of these details, while it might seem second nature to us because we're in the practice and we're already doing that day to day, remembering this person is brand new. So make sure they feel as comfortable as possible prior to them arriving. They know what to expect. Kind of relate it to thinking of a new patient experience that you hope to create. You want to do the same thing to take care of a new team member so that you're really starting off the relationship well. It's also important to set your expectations from the beginning. This is done through a formal onboarding process. So I know it's like, again, we have patients, we got to get them in there, but you do not want to skip the steps of formally onboarding them. And this also relates to filling out their new hire paperwork. So on average, there are 12 to 15 documents that a new employee should be filling out and signing on their first day of work with you. Once again, this varies per state. If you're in California, it's 19 documents. If you're in Florida, it's about 10. So that's just the average. These change all the time as laws change as well. So just try to keep up on that. Again, we help you to maintain that, but make sure if you're only giving 3 to 4 documents right now, I-9, W-4, direct deposit, emergency contact, usually the most common ones, make sure that you're kind of expanding that for what you should be offering in your state. If you have questions, reach out to us. Your employee handbook should be included. Absolutely such an important way to set your expectations. That is kind of the Bible for your office. That is saying, these are my expectations. This is how things are run. And then the job description is for that individual expectation. So both of those things should be paired. If you have not updated your handbook yet for 2024, please promise us you're going to make that a priority. We're already almost in April. We have a ton of resources to help you do this. If you're a client, we do it for you, but definitely prioritize it. Because what you have in writing, going back to the retention conversation, you really want to make sure what you actually expect is in writing and then you're upholding that. Also, give them that job description that you are using to recruit them and to get them into the office. That should be given to them on day one for them to acknowledge, because we're making that full circle of this is what we talked about. Now that you're here, this is what's in place. So just don't forget to take the time to have them do that onboarding. And then all of the other aspects, again, of what to expect, giving them a schedule for that first week so they know what to do. And thinking about your policies, not just from the requirements of your state, but really how your office is functioning. So, what is your cell phone use policy? What's your attendance policy? What are the uniform expectations? Like, again, those things that we touched on, that you might be offering all these cool perks or you might have certain expectations. That should be translated into writing so that they're reviewing that on their first day, they're signing it, and then ideally you have your handbook and these policies and documents in a place where the team members can access them afterwards. So if they have questions on certain things, they get called in for jury duty. That's in the handbook. They know what to do, they can access it, and I guess selfishly, they don't have to bog you down with asking you because it's in writing. You say, just go read the handbook, you have access to that. Um, and then, of course, pay them for the time that it takes to fill out their paperwork. This is a misstep that we see. Definitely, first thing you want to do when they come into the office, having them clock in, making sure that they know how to do that, where they're supposed to clock in. If you're using HR for Health, when you log in, they clock in right through there, and then all their paperwork's automatically sent to them for them to fill out and sign. So it's kind of combined, but just don't forget to have them clock in for that time. We recommend usually setting aside about an hour in the morning, right on their first day, have them get through all of their paperwork. If that means them coming in an hour early, maybe you pay them an extra hour for that day, longer than you would other days, or you just carve out time in that first day for them to be able to do that before they start seeing patients. Just don't let it go more than the first day because then you forget about it. And there's also requirements that they need to fill out and sign this within a certain time frame. And last but certainly not least, reminding the employees of what they're allowed to take or expected to take in terms of their meal and rest breaks. So the regulations vary per state, but if you have, let's say the requirement in your state is 30 minutes for a lunch break, but you give them an hour, hey, every day from 1 to 2, the whole office closes, we all take lunch, communicating that so they know what to expect before they come in, and then reiterating that because that's something that's super easy to fall to the wayside once things get busy. You should have these policies written in your handbook, but again, reminding them when they come in what they're able to take. And again, we have this all into our system. So if you're not an HR for Health client, all of the documents are sent out electronically that they have to fill out and sign. We maintain those. So as those change, you have them up to date. Same with the employee handbooks. We keep those up to date. We really take on the heavy lifting for you. And then even from the meal and rest break perspective, because we have an employee scheduler tool within the system, you can actually schedule your team for their rest breaks and for their meal breaks. So it's no question for them of when they're supposed to take it. They have full transparency, and it's really giving them a good experience from day one. It shows them that you care about them when you are making their employment easier with you and that you have that transparency. Okay, I know we only have a couple minutes left, Taylor. I don't know if we have time for questions, but
Yeah, I see a couple people jumping off because I know we're wrapping up here. So we will follow up with those that did ask questions. We'll be sure to follow up after the webinar. Jill, if you want to go to the next slide, I want to be sure to share our resource with you guys. This was what I mentioned at the beginning of the webinar, our ultimate hiring playbook crafted by HR for Health and Kwikly. And a lot of what Amanda and Jill covered is in this hiring playbooks, plus so much more, and especially the job description templates that Jill was talking about. Those are at the end. We have 7, I believe, specific job description templates that you can access, look at, go off of, download, whatever you want to do with those. But those will be really helpful in your practice as well. So go ahead and scan that to download the playbook and keep for your access. I want to thank Amanda and Jill for both of you guys coming on and sharing all of this with us. I know this has been super helpful. If there are any other questions, you can reach out to hello@hrforhealth.com and we'll make sure that Jill and Amanda are able to get back to you with your questions. Thank you for joining us today.
thank you.